Infection numbers climbing fast, calls from health professionals for tougher lockdown restrictions are growing. For a view from frontline workers, let's speak now to the South African Medical Association's Dr. Angelique Coetzee. Dr. Coetzee, good morning and thanks so much for your time. Yes, it is indeed worrying and many people might agree that we need tougher lockdown restrictions. What would you like to see happen? What would SAMA like to see happen now?
Thank you. Thank you for asking SAMA's opinion on this. This is really very difficult times that we are now entering. And from SAMA's side, we would like to see stricter restrictions regarding social gatherings, especially the churches, post-funeral nightclubs and shebeens are some of the problems. Regarding the churches, it would be fine if churches can have their services out in the open. We do not have a problem with that, but everything around four walls, we need to reduce the number of people going into such facilities. Also, we are concerned about what is happening in certain of the malls out there and shopping centres, and we would like to see that only people who really need to go and buy the food go into those shopping centres or malls, and the rest of the family stays in the car. Also, regarding the sale of alcohol, we would be very glad if we can have a moratorium on the selling of or the sales of alcohol over the weekends, as the weekends are when the casualties are quite full of patients with alcohol-related incidences, motor car accidents, as well as now we are seeing this steep increase in the COVID-19 patients, and also we know that this time of the year there's a skeleton staff at these facilities. We would also like to see, but this got nothing to do with the lockdown, but we would like to see the moratorium lifted on the already posts that are allocated to hospitals from the provincial side, and SAMA will be in January start to negotiate with the premiers, the MECs, Treasury, as well as public services or public works, as they all now need to come to the party. This is not sustainable. The whole system, we were warning the healthcare system since October this year that we will see our second surge in mid-December going into January, and unfortunately I must say our healthcare facilities cannot handle the current increase of patients that's really sick.
Well, Dr. Coetzee, that seems to be the common experience among all medical professionals and different bodies at the moment. Many people saying that, you know, the president should actually have shut down interprovincial travel, should never have allowed it in the first place. This, of course, well, it is too late to do that now. But do you think that might be something you would like to hear from him? When we hear from him, could be today, could be tomorrow, or sometime this week. Do you think that might go a long way to helping everybody cope and containing this?
The problem with the provincial traveling is people work, they stay at the branch of one province and work in the other province. We have seen that some of the hospitals, especially in the Eastern Cape, when this was in force, I think it wasn't still in lockdown 3, that patients cannot or don't have access to healthcare facilities because the only healthcare facility closest to them is in another province. And so that's not really the answer. We need to look at the taxis and the buses. But again, that's the only form of transport. I'm not sure what happened to our railroad, as part of traffic, as a part of transport.
Public transport, yeah.
Yeah, I'm not sure. I don't see people traveling by train anymore from one province to another, or you don't hear it that much, and maybe I'm just unaware of it. But that's something that one needs to start looking at, as the taxis might be a problem, especially if you're longer than half an hour in a taxi and it's loaded to capacity. So all of that plays a huge role. Again, for us, we are much more worried about the super spreaders that we are seeing in where there's social events are happening. and especially if that event is happening indoors and not outdoors.
Do you think that we're putting too much faith in a vaccine, that we're relying too heavily on a vaccine when we actually get it? It seems to be a glimmer of hope, but really, just considering how we are behaving, you have to wonder just how far it's going to go to helping us contain this thing.
Well, as you correctly said, the vaccines is just a glimmer of hope. It's not the miracle cure that's going to happen. Unfortunately, even when you have vaccines available, if and when, and again, you would not be able to immunize the whole of the country, in one go. So the basic things is still there. It is the masks, the social distancing, the ventilation, and the hand wash. The virus so far hasn't had any way of getting around this. So if we don't wear those masks, and if we keep on going to the shebeens, if we keep on going drinking at places that's not my own home, you are yourself are eligible to get the virus, but you can also be a spreader and then bring it back home to your family. So if you don't care for yourself, just think about your family. And I find it extremely frustrating to see the people of South Africa. And again, for those of you who are hearing and who are wearing your mask and who is doing the right thing, I salute you. But there's a majority of people that doesn't listen. They just seem not to care. And I think it is high time that they are made responsible. Whether some is now in the process where we say, just find them or let them do community service, let them do anything just so that they can learn from their behavior, because we've got a country that doesn't seem to listen. There's a lot of behavior problems, and then on top of the behavior problems, we've got alcohol-related problems and drug misuse and abuse in our country. And it's not sustainable.
All right, Dr. Angelique Coetzee from the South African Medical Association, making it clear to us the time has come to put our foot down, and we need some tough rules, because it seems people need tough rules in South Africa. We don't know how to keep ourselves safe. Well, harsher